Hi, my name is Amelia. I am going to be your nurse today, okay?
Okay.
I'm going to go ahead and provide privacy for my patients. After that, I'm going to go ahead and perform hand hygiene and wash my hands. After that, I am going to go ahead and verify my patient's name band. Can you tell me your name and date of birth?
My name is James Daniels. My date of birth is August 2000.
Alright, my patient verified his ID and date of birth with me. James, we're gonna do a head to toe assessment today, okay?
Okay.
At the moment, can you tell me where we are today, James?
We are my home.
Can you tell me what day it is today?
Today's date is March 29.
Okay, and can you tell me what we are doing today?
A head to toe assessment.
Can you tell me the United States President?
President Joe Biden.
Perfect. My patient is 4 times oriented and articulated. I am going to go ahead and perform vital signs. My normal vital signs for temperature is 97.8 and blood pressure is 120/80 and my O2 saturation is 95 to 100%. My pulse rate is 60 to 100 beats per minute and respirations is 12 to 20 breaths per minute. After performing my vital signs, I am going to go ahead and apply my gloves. And just by inspecting my patient's head and face and his body, I can say he's dressed appropriately for the weather. I'm going to go ahead and palpate his hair and scalp. My patient's hair looks good. There is no lines, there is no lesion, and his scalp looks good. After palpating his head and scalp, I'm going to go ahead and look at his ear for any scars and was. There is no scars. Everything looks good. I am going to go ahead and look at his face. His face looks symmetrically. I'm going to go ahead and check or assess his cranial nerve 7, which is the facials. James, you want to smile for me? You want to frown? And you want to puff out your cheek? Perfect. My patient looks all good. His facials looks good and there is nothing wrong with it. I'm going to go ahead and inspect his eyes. His eyes looks good. I'm going to go ahead and shine this light on you, James. Everything looks good. I want you to follow the direction of my pen light, okay? I could say my patient's pupils are equal and brown and reactive to light, and they are also accommodating. The sclera is good and white. There is nothing wrong with the scleras. I'm going to go ahead and have you close one of your nostrils and breathe in from the other. Same thing to your other one. Alright, I'm going to go ahead and look at your nostrils. If there is any scars, no redness, everything looks good. There's no drooling. I am going to go ahead and have you open your mouth for me. My patient's mouth mucous membrane is moist. Do you want to say ah?
Ah.
His uvula membrane, his uvula rises up and down as well, and there is no obstruction on the way. His lips looks pink and there is no missing teeth. I am going to go ahead and just by looking at my patient's neck, there is nothing wrong with it. You want to move sideways for me, James, and the other way, and you want to look up, down. Perfect. My patient looks good. I'm going to go ahead and check his carotid pulse. And this has to be done bilaterally. Carotid pulse looks good. I'm going to go ahead and auscultate his carotid pulse as well. and my patient's carotid pulse is +2 bilaterally, and there's nothing wrong with it. And just as looking at my patient's chest, he doesn't have any labored breathing. He's breathing effortlessly, and there's nothing wrong. And my patient's skin color looks even, and his skin looks even. There is no tattoo, there's no piercing, I could say. And James, you want to stretch forth your hand for me? I'm gonna go ahead and inspect his fingernails, and I'm gonna go ahead and check for capillary refill just by pressing the neck bolt down. And his capillary refill returns in less than 3 seconds. And after that, I am gonna go ahead and I want you to sit, come forward for me a little bit. Very nice, just sit. And I'm gonna go ahead and listen to his heart sound. Gonna go ahead and listen to his heart sound. And his heart sound, the S1 and S2 goes up and down. There is no wheezing, there is no bruit I could hear. And after listening to his heart sound, I'm gonna go ahead and auscultate his lung sound, and we're gonna do that anteriorly and posteriorly. So James, I'm gonna give you some directions. You breathe in and out for me in this process, okay?
Okay.
So we're gonna go ahead and listen to the lung sound at the moment. I want you to breathe in, out, breathe in, out, breathe in, out, breathe in, out. I'm gonna go ahead and listen to the backside of his lung sound. And I'm gonna have you breathe in and out for me as well, okay, James?
Okay.
Breathe in, out, breathe in, out, breathe in, out, breathe in, out. And his lung sound is clear. There is no bruit, there is no wheezing. All right, James, I'm gonna have you lie down this way. I'm gonna have him lie down in the supine fold. All right, we are gonna listen to your apical pulse, and we're gonna listen to James' apical pulse, and it's gonna be for 1 full minute, starting from the left side. I'm gonna go ahead. And the apical pulse is located at the fifth intercostal midline. I'm gonna go ahead and listen for 1 full minute. my patient's apical pulse is good. So James, your apical pulse rate is 86, which is normal range of for apical pulse. And I'm gonna go ahead and inspect his abdomen. Just as looking at his abdomen, there is no lump, there is no bruises, everything looks good. And we're gonna go ahead and listen to your bowel sound. And we're gonna do that starting from the right lower quadrant. And that way we go clockwise, all the four quadrants. Now we're gonna go ahead and auscultate the bowel sound. After auscultating the bowel sound, we're gonna go ahead and percuss. Do you feel anything while I do this?
No.
After auscultating, we're gonna go ahead and palpate. After percussing, we're gonna go ahead and palpate. Do you feel any pain when I do this, James?
No.
Okay. And there is no pain present during palpation. All right, James, I'm gonna have you sit up right now. And we are gonna go ahead and check his pedal pulse. All right, let me check your pedal pulse, okay? We're gonna check his posterior tibial pulse now. And pedal pulse and posterior tibial pulse +2, normal. And after that, I'm gonna check his range of his muscle strength and range of motion. I'm gonna have you stretch your hand forward, sideways, bring it closer, upwards, this way. And I'm gonna have you do the same thing to your leg. Move your leg sideways, closer. You want to move it towards me, back to you. And his muscle strength is 5 out of 5. There's no hard effort in him doing that, I could say. So he has 5 out of 5 muscle strength. And after that, I am gonna go ahead and check for edema, if there's any edema present. The other side. There is no edema present. And James, do you have any question or did you feel any pain by chance?
No.
All right, after that, I am going to go ahead and have my patient with handing his call light within his reach. And after giving him his call light, I'm going to make sure the bed is lowered down. And after lowering the bed down, I'm going to go ahead and perform hand hygiene. All right, James, I am going to notify the doctor that you're ready for your procedure, okay?
All right. Thank you.
All right, bye-bye.